Today, I'm going to walk you through how to get rid of bladder infections and how to prevent recurring urinary tract infections. First, I'll explain some of the things that may increase your risk of developing a urinary tract infection. Then, I'll wrap up with 5 simple steps you can take to help prevent bladder infections. And finally, we'll clear up a common question about cranberry juice. Does it actually help prevent UTIs? Be sure to stay with me until the very end to find out. So, what are some medical conditions or factors that can raise your risk of urinary tract or bladder infections? One important factor is menopausal status. Women who are approaching menopause or who are already postmenopausal have a higher risk of infections. This happens because estrogen levels decrease, and estrogen actually helps protect against urinary tract infections. In addition, certain health conditions, like diabetes mellitus or other conditions that weaken the immune system, can increase your chances of developing bladder infections. Certain habits, such as holding your urine for long periods, can also raise your risk. If you have any structural or anatomical differences in your urinary tract, that can also make infections more likely. Interestingly, women who experience recurrent UTIs are much more likely to have a family member who also deals with recurring urinary tract infections. If you have 1 or 2 family members with a history of these infections, you're about 3 times more likely than the average person to experience them. If 5 or more family members are affected, your risk increases to about 5.5 times higher. Now, you may have some of these risk factors, but it's just as important to understand what does not increase your risk. First, and most importantly, hygiene is not a risk factor. If you get infections, it does not mean you are unclean. If anyone has ever told you that, it's simply not true, so you can stop worrying. There is nothing about poor hygiene causing your bladder infections. Other things that are not linked to recurrent UTIs include using hot tubs, tampons, douching, wiping from front to back or back to front, your favorite color, or the type of underwear you wear. None of these will increase your risk of getting a UTI, so there's no need to be concerned if you do any of these. If you're someone who frequently gets bladder or urinary tract infections, it's important to pay attention to your symptoms. Common signs include pain or burning during urination, needing to urinate more often or urgently, discomfort or pressure in the lower abdomen, and new or worsening bladder leakage, or even blood in the urine. So, if you're experiencing those symptoms, make sure to have your urine tested. Especially if this is happening more than once a year, it's important to get a urine culture done. A urine culture helps identify the exact bacteria causing the infection and shows which antibiotics that bacteria will respond to. This information can be very helpful for any doctor you see when deciding the best treatment for recurring bladder infections. Alright, now let's get to the important part. 5 simple things you can do at home to help prevent recurring bladder infections. Number 1. Drink more water. Quite a bit more. What does that really mean? There was a study where women with recurrent bladder infections were divided into 2 groups. One group continued drinking their usual amount of fluids, while the other group drank their usual amount plus an extra 1.5 liters of water each day. The result? The group that increased their water intake reduced their infection rate by 46%. So, something as simple as drinking more water can make a big difference. Number 2. Avoid using spermicidal products. That means not coming into contact with them during intercourse and avoiding lubricants that contain spermicide, as these have been linked to a higher risk of bladder infections. Number 3. If you have what's called dysfunctional voiding, seeing a pelvic floor physical therapist can really help. So, what is dysfunctional voiding? If you feel like you have to strain to empty your bladder, or you often feel like your bladder isn't fully empty, this could be the issue. Make sure to mention these symptoms to your urologist or primary care doctor, as they could be contributing to your infections. Number 4. Vaginal estrogen. As mentioned earlier, women who are perimenopausal or postmenopausal experience a drop in estrogen levels, which can increase the risk of bladder infections. Why does this matter? Estrogen affects the lining of the vagina by increasing lactic acid and creating a more acidic environment. This acidity helps prevent bacteria from growing in the vagina and urethra, where bladder infections typically begin. It also helps stop certain bacteria from attaching to the bladder wall. There is strong evidence that using vaginal estrogen, either as a cream or a suppository, can help reduce the risk of recurrent bladder infections. If you are a woman who is postmenopausal or approaching menopause, it's a good idea to talk with your doctor about this, because it can be very helpful for you. Number 5. Cranberry. I mentioned earlier that cranberry juice might be a myth, so let me explain that now. Cranberry juice on its own, especially the kind you commonly see like ocean spray, is not likely to prevent recurring bladder infections. The reason is that you need a specific amount of the active compound found in cranberries called proanthocyanidins. Research has shown that a dose of 36 milligrams is what can help prevent bladder infections. So how do you actually get that amount? You'll need to look for supplements that clearly provide 36 milligrams of proanthocyanidins. It's also important that these supplements are soluble, meaning they are made from cranberry juice extract itself, not from the skins or stems of the cranberry. If you can find a supplement that is soluble and contains 36 milligrams of proanthocyanidins, taking one daily can be just as effective as using a low-dose antibiotic every day to help prevent bladder infections. Is it harmful? No. Could it help? Yes. So it may be worth giving it a try. Alright, that's everything for today. I hope you found this helpful. If you did, be sure to subscribe and click the notification bell so you don't miss my new videos every day. Thank you so much for watching, and always remember to take care of yourself, because you truly deserve it.